I mean, when I talk to people, it really is about poking holes in whatever, propaganda thing that they've sort of fallen for,
Mm-hmm. Yeah.
specifically around things like healthcare.
Yeah, it's true.
Well, one of the things I like to do with I'm sorry, is because I worked in the school with these students. And so
Mhm.
like, there's this one fellow that I've talked to a lot, because he's the father of this girl who wrestles and plays football with my kids.
Oh,
And
okay.
so, and he's like a MAGA. And so we end up hanging out. I'm like, your friendly neighborhood commie. And they all put up with me. And it's interesting because so he's a veteran and he is like, well, I have health care already and blah, 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 blah. And you don't go with the VAs because you don't point out that socialized medicine because a lot of veterans don't like the VA. So don't go with that. Don't go in that route.
Mm-hmm.
But so I point out, well, I go, you know what? Can we at least agree that healthcare shouldn't be attached to someone's employment? Because when they closed the schools, I was working as a long-term sub. I was teaching his daughter fifth grade science. And when I take, so, if I'm not working, I have Medicaid. People tell me to get a better job. So I get a better job. Being a long-term sub pays better. But what ends up
Mm-hmm.
happening is then I lose my health insurance and my food stamps because I make too much, even though it's a temporary job. And then I said, well, you know what, that February, right before break, I was praying to God that I would not get sick until vacation, because I wanted to be sick over my vacation because I didn't have sick days and I didn't have a doctor to go to. And I have ear problems. And I was like, how am I supposed to get in front of this classroom full of fifth graders with an ear infection, no sick days, and no doctor? And that lands it right in his lap. It's like, bro, I was your teacher. I'm your daughter's favorite staff member. She still comes in my room every day to
Mm-hmm.
to come and see me. And it's like, here I am, and that's like a personal story. And he's like, oh, well, shit, you know, because if you don't experience it, then you sort of don't know.
Mm-hmm.
And what's interesting is he has health insurance through the VA, but he also has, so he says, well, I earned mine. And I go, well, that's okay. And then he goes on to explain. So he has a son who's pretty severely disabled. And
Mm-hmm.
so he's like trying to vibe with me about it. And he says, well, I pay monthly extra because for my son's disability. And I go, well, how is that fair? And he's like, because my son is disabled. I go, so why should you have to pay more for health insurance than like I do? Because you have a need and I don't. And I said, you realize what you're doing is paying a disability tax. That's basically what that is. And again, his little behind his eyes, you know, I was like, look, I have socialized medicine too. It's Medicaid. My kids are pretty healthy. They may injure themselves. They get strep throat on occasion, but ultimately speaking, we don't use a whole lot of our health care. We just need to have it for when we have ear infections and stuff. His
Mm-hmm.
son has severe disabilities. Fine, take mine. Take my share, and when I need it, someone will give it to me. So, but it was really funny. I mean, because we went on and round and round and round, and finally, I was like, you realize that you're paying a disability tax, and he was like, again, like behind his little brain exploding. I'm going to turn them all into communists, I swear. Little at a time. Yeah.
This is why we have conversations. Number one, conversations with people you don't agree with, and that you can move them over to the left. Number one, it humanizes you to them
Yeah.
because now you're not just some boogeyman in the shadows. You're their friend or you're their associate in front of them with dreams and aspirations and hopes and
Right.
love and sorrows. They see you as a human being. And so then you start to give the reasoning. And then you start to go issue for issue. And next thing you know, guess what? You break down that logic. Because let me tell you this. These are the same people that will listen to a Tucker Carlson, that are
Mm-hmm.
listening to a Ben Shapiro, that are listening to a Marjorie Taylor Greene. And what do we do constantly on the left? We're always breaking down their arguments. Always. It's easy for us.
Mm-hmm.
what makes you think it's not going to be easy with people who we may interact with? And if you do it in a very compassionate and kind way, then number one, you may have shifted them over to the left. Number two, you may have gained a comrade.
Mm-hmm.
And I'd rather have a comrade than an enemy. I'd rather change an enemy from a comrade to a comrade than destroy my enemy.
Right.
Because that means I have one more person that has a role in the revolution.
That's right. And what's interesting is that's not so much the experience I have when talking to my liberal neighbors. At caucus, the story I usually use to describe, and it's a true story about my family and 3 different levels or 3 different health insurance situations.
Mm-hmm.
So, and I shared this story at caucus for 2020, and I said, so one day my then 4th grader came home with strep throat, and it was really scary because he got a super high fever, and we live pretty far from the hospital, and we weren't sure if we should go now or whatever. But he had Medicaid. So we went to the doctor, they did the swab, we got some medicine. 3 days later, he's fine. At the time, I had union insurance through my job at the school, which means that I have access to healthcare, but I also need to have time off from work. I need to have money for copays, and I need to have money for prescriptions. Now, the thing is at my job, they gave me 100% coverage for free, but I couldn't afford to put my husband on at all. So what happens when my son is fine, but what happens when I get strep throat? I have access to healthcare, but I don't really have healthcare. And what happens when my husband gets strep throat, who has nothing? That's entirely out of pocket. That is one household and 3 different health insurance situations. And this shit lib, she goes, why don't you get the Obamacare? I go, that costs money, right? And she's like, but it's affordable. No, it's not affordable. Actually.
It's not affordable for who?
Affordable for who? Seriously. I did the math one time even. I said, because when I take that job and when I take the long-term sub positions and I lose my Medicaid, so it says, because I make too much money. So I went and found out, I did an experiment with my kids. It was really funny because I homeschooled them last year. So we did this for an experiment. Mm-hmm. So I signed up online to get some quotes about what your insurance would cost me. And of course, for days and days and days, I got emails, text messages, phone calls, because they spam you trying to get you to sign up. But mathematically speaking, so I qualify for Medicaid because of the poverty level, which is incredibly and disingenuously low.
Yes.
That's an entirely different conversation.
Oh, we're going to have that conversation.
Because poverty and poverty law and social services is a passion of mine, and I've worked in social services a long time. But I lost my train of thought there. But so I take the job and I make too much money to get the free stuff. So I try to get the pay stuff, but when I pay for it, that puts me back below the poverty level. So what are we doing here with this? And so I explained, so I'm like, well, it's not, I can't afford it. I work at the school. I'm an educator. I don't make any fucking money, and she goes, well, I guess I'm selfish because I already have Medicare. And then she fucking gives me a $10 bill and tells me to take my husband out to lunch. Wait. Shit you not. My husband was right there.
Hold on. Wait. Hold up. I just want to talk to her. I just want to talk to her. Are you kidding me?
I couldn't believe it. A $10 bill. Wait. A $10 bill. Let's go out to lunch. What fucking century are you living in? True story.
Wait, so she basically gave you a $10 bill and said, get a cheap meal at Chipotle and split a burrito between you and your husband. That's basically what she just told you.
Yeah. She goes, I guess I'm selfish because I have Medicare.
Wait,
you're damn fucking right. You're selfish.
She said you are selfish?
No, she's selfish. She goes, I guess I'm selfish. I already have Medicare.